Welcome, and thanks for listening to Intrinsic Investigations. My name is Mr. Olivo, and I created this podcast because I've been fortunate enough over the last decade to see unique and thought-provoking projects happen in my classroom, and we wanted a place to showcase them. The true heart of this podcast lies not in the content discovered, but in exploring the personal stories of these young researchers as they journey through uncharted and unfamiliar intellectual terrain. By sharing their stories, we hope to normalize the challenges and frustrations that come with independent research, and also share those moments where students transcend the normal grind of the school day to discover concepts that range from the global to deeply personal. We will begin with a brief introduction to the student of focus, why they picked their topic, and discuss their growth over the course of the last year. It should be mentioned that the opinions expressed in this podcast in no way reflect the opinions of our school district, Bergen County Technical Schools and Special Services, or our school itself, Bergen County Technical High School, Teterboro, or the College Board. The work detailed in this podcast was most likely completed in AP Capstone, but this podcast is in no way affiliated with the College Board. We are back with another episode, and today you're going to meet Chloe, who is going to be discussing Reddit discourse surrounding cystic fibrosis and sickle cell anemia.
Yes.
Before, I know I just sort of half introduced you there, but you want to give them the full introduction. Who are you? What was your work about? And what did you ultimately discover?
Yeah, hi. So my name is Chloe. I'm a junior in AP Research, and my study was basically trying to find differences in racial bias and treatment quality between patients with cystic fibrosis versus patients with sickle cell disease using Reddit as the main medium of sourcing posts. And ultimately what I found, it basically corroborated the literature that already existed, that sickle cell disease patients basically faced worse care across basically every dimension of care, including stigmatization, wait times, sort of things pertaining to racial bias especially. And yeah, I found 5 inductive themes that I'll go into later, yeah.
Great. Before we get into the bio of this, because by trade I am a bio teacher, so we are going to talk about a little bit about heterozygous advantage and all those things. I don't know how much of this you covered in bio this year.
I don't really know what that means.
All right. You'll get there. It's okay. Before we get into this, why did you pick this topic? Why was this something that you were interested in?
Yeah, so I actually came across a TikTok video last year.
You're about the 9th person now who's...
Yeah.
This is fine. You stumbled upon it. Okay, so go right ahead.
Yeah, so it was a TikTok video of somebody in the emergency room. It was a woman recording somebody else. Well, not somebody else, but recording herself talking about somebody else. And basically she saw a black man lying underneath, it was by a bench, the little waiting benches on the emergency room. He was lying down on the floor, clearly in pain, closing his eyes. And people were just walking past him, and she was there the entire time he was there. And she just saw him just waiting for hours and hours while other people got seen. And she was basically wondering what's going on. And she was also a black woman, so she was is there something going on here like this? I just am so tired of us being treated like this. Mm-hmm. And then all the comments were talking about something called sickle cell disease, which I had never really heard of before. And there's a feature on TikTok where it turns into a blue comment, and you basically click on it, and it brings you down this rabbit hole of search results. Okay. So I clicked on sickle cell disease, and it brought me down this rabbit hole of basically what it was and people sharing their experiences on TikTok. And I was just reading all the comments, and people were saying yeah, experiences like these where we're basically mistreated is a really common thing. And it's a lot to do with racial bias and how our disease is perceived in society and in the healthcare system. So I was really interested by that.
Okay. And when did that, we start school in September. Mm-hmm. The project's wrapped up at the end of April, early May. When did you stumble upon this? Was this before you took the class, or was it while you were taking the class?
Yeah, this was during sophomore year, and it's funny because
Okay.
I wrote it down in my notes app. I was maybe I should do something with this, and I forgot about it. And then I looked back on it after I already chosen my subject in March, and I was oh my god, I predicted the future.
That's why we write things down. That's why I have over there hanging up. You want a thought, idea, or connection to time travel, you write it down. That's it's a unique story, but it's also becoming so common that you and other students like yourselves are getting exposed to content, and you're just curious enough to kind of notice hey, what is going on in this situation. I honestly thought that you were going to say something like, oh, I was in bio class and we were talking about sickle cell anemia and hydrophobic and hydrophilic amino acids, and that's where it went. But that is not the case at all.
Yeah, but it's like a funny coincidence because we use sickle cell disease and cystic fibrosis as like case studies, like right after I decided on my topic, and I was like, this is so perfect.
Oh, so you did talk about it in bio after?
Yeah, both diseases, like specifically only those two too.
Why?
For bio?
Yeah, like why were you talking about them in bio? Like what was the sort of like the point of the lesson? I'm just curious.
I guess just like genetic mutations and like hemoglobin, talking about that, and like the protein associated with sickle cell disease.
So do you know why there is why people of darker skin tones who live in Africa or are of African ancestry, because they don't have to necessarily be African American. Like anyone can have any, like they can carry
like a mutation.
Yeah. But do you know why it's more prevalent in African populations and those with their ancestry there?
Yeah, it's actually really interesting. Like, I never thought this could be like the case, but like, you know how malaria is very like endemic to sub-Saharan Africa? It's basically the mutation associated with sickle cell disease. Researchers believe, at least, like there's this like the current hypothesis in scholarly literature.
Oh my gosh, it's such nuanced science talk. I'm so happy right now. Keep going.
Okay, that it's like it's a mutation that derived from trying to be able to combat malaria, specifically because that disease is really endemic to the sub-Saharan African region. And one of the side effects of that mutation basically is the sickle cell disease trait, which obviously is not good, but in theory, it's supposed to be helpful in terms of battling malaria. So, yeah. Yeah,
that's essentially it. Do you know the story with the CFTR gene associated with cystic fibrosis? It's actually a fairly similar situation. Do you know the connection there as to why it became more common in Northern European populations?
Oh, I actually don't. I didn't stumble on that.
So what you were just describing in terms of malarial resistance, there's a prevailing hypothesis that the mutation of the CFTR gene associated with if someone has two recessive alleles of that, that if you're a carrier, if you're heterozygous, you're actually slightly resistant to tuberculosis.
Oh, wow. I didn't know that.
Yeah, which was more common in Northern and European populations. So these diseases could easily exist in reverse cases if lighter skin populations were living in more malarial exposed areas and darker skin populations were living in more.
Yeah, it just so happens like geographically.
That's just how it ended up working out. But yeah, the degree of it's funny how much the diseases have in common.
Yeah, that's why I chose.
Yeah, but it's like cholera, typhoid. I'm just double checking. Cholera, typhoid, and tuberculosis. You have a conferred slight resistance. Like it's not guaranteed, but it's kind of like the malaria situation. Okay, so that's kind of the bio that's going on there. Now, with your work, you're looking at these diseases. Obviously, they're medical phenomena, but you're looking at them. You're looking at them in a social context and the social ramification. Well, the social and medical ramifications of how people outside of the people afflicted with these diseases are experiencing these diseases. Is that like an accurate?
Yeah, and basically how that's affecting the patients themselves.
Okay.
Yeah.
So how did you go about trying to figure that out? What was your method to try to figure out, hey, how are these perceptions of people with these diseases, or stigma, I guess for lack of a better term, how is it impacting them?
So I originally wanted to use like TikTok videos because that's like how I stumbled upon the topic itself, like in the first place. And so my first like method of going about it was I was going to use X and TikTok, but then I quickly realized like there's not really a lot on X, which used to be formerly Twitter, and on TikTok, like the short form videos, they were kind of hard to basically take a narrative out of them because they were just so short, and the comments were sometimes you don't know like who the user is and stuff like that. So I ended up using Reddit because I found like these subreddits which were basically created by users who have their specific diseases for users with their specific disease. For example, I used r/sickle cell and r/cystic fibrosis. And what these subreddits are, they're basically like a group within Reddit where they have users who are part of this group and they share their experiences having these diseases. And what I did was I sourced these posts from both subreddits respectively using keywords like hospital stay or emergency room. And I basically just tried to find posts that shared a story of how they were treated by healthcare providers and how that basically made them feel or how that impacted their health. And yeah.
I'm guessing that on Reddit, and I'm open to being wrong here, but I'm guessing that on Reddit they're talking about, in these community support groups, they're probably talking about a lot of different things.
Oh yeah.
So how did you sort through what you were seeing to be like, you know what, this is a post that's obviously part of my study. This one, maybe not so much.
Yeah, so within subreddits, there are little like chains where people can ask like a topic sentence or question, or they'll be like, it's like hospital stay, and then you click on it and it's a post, and there are a lot of comments underneath it, because the whole point of like these like support groups, as you said, it's like have other patients who understand their experience sort of like give them advice or ask questions for each other specifically. And so I would search up, like I said, I would use keywords like hospital stay, and then I would use I would go like one by one, and there were some that I couldn't include. And then, I also had exclusion and inclusion criteria, so they had to be within the last 5 years, because I wanted to get like the post-pandemic sort of experience and how that might have like
that
impacted.
Makes sense.
And they also had to be more than 75 words and based in the United States, but that's like besides like the most important part. But I would click on a post and it would have to be pretty long, and the person would be talking about an experience that they had in the hospital, which were the most common for sickle cell, because that's where they received most of their emergency care. So a typical post that I would include, it would be like, I'm in the emergency room, and then the post would talk about something that resonated with one of my deductive codes that I had already created prior to finding these posts. So for example, one of my codes is drug-seeking stigma or something like that. And so
if you're just here for drugs.
Yeah, where the provider would basically be like, I don't think you're really in pain. You don't need these pain medications, which like is like a whole social thing in of itself to like get into later. But then the patient will be like, my doctor refused to give me the medication that it's clearly in my personalized care plan, and I'm in so much pain. Does anybody know what to do? And that would be something that I could be like, here's a clear example of this specific code. So I would put that into my Google Sheet to save for later.
And you said that you had some deductive codes to start with. What were some other things other than drug seeking?
So I had 10 deductive codes that were made from the existing scholarly literature, from things I did like my annotated bibliographies on, and just stuff that I've been seeing recur in themes. So I've already expected these things to occur. So I have things like wait times, medication access and adequacy, belief of pain, provider expertise, which is like if they know about the disease itself, and things like that pertain to how the provider basically gives them care and how the patient feels when they're given that care.
And you applied both of these to cystic fibrosis
Yes.
posts, and sickle cell posts. Did you leave this open to inductive coding as well? I think you did, right? So like, how did you handle that part of the process?
Yeah, so it wasn't really like an inductive coding, but more of like seeking themes.
Yeah.
So So I saw like patterns from. So initially, I had 2 phases of basically my method of the actual coding the posts. So my first part was taking all the posts that I had gotten from Reddit, which were, I think it was like 23 for sickle cell and 12 for cystic fibrosis, just because people were posting more often on the sickle cell disease forum than the cystic fibrosis. So like those were all the posts that I could get within my exclusion and inclusion criteria. And then between those posts, I had like a drop-down sheet in my Google Sheets with 10 of my deductive codes. And for each of my posts, for each of my codes, I coded if they either fell under yes, no, or simply no mention.
Okay.
And then after that, I also had a column like to the right of all that, which was like my notes and context. So any themes that weren't identified in the 10 deductive codes that I already had, I basically wrote down like a quick summary of what it was and why this stood out and was important, especially if I saw that happen across multiple posts. And then once I was done with my deductive coding and I calculated the frequencies of each code for the posts, I then moved on to the sort of inductive portion by looking at the notes and context and like rereading all of my posts and basically saying, here's an interesting theme that wasn't like discussed in my 10 deductive codes, and I ultimately ended up with 5 inductive themes along with my 10 deductive codes at the end.
And those themes were?
Let me read them out because they're a little specific. I have, for the first one, it was, sorry, I'm just trying to, I want to get it correctly.
Again, that's why we write. It's why we write things down.
Mm-hmm. So my first inductive theme was patient silencing, and it was basically where patients actively suppressed their pain responses to avoid being seen as like difficult or being labeled as drug seeking. So people would be like, "Oh, I don't really like." They don't reach out about their pain, and they don't say like, "This is like really bad pain." And the second inductive theme was medical trauma avoidance, and this was actually the most like prevalent finding of my study, and it was like really shocking to me because I saw multiple posts where patients, they basically chose the risk of their life-threatening crisis over going to seek help. So they would purposefully not seek help because they were traumatized by that previously biased encounter. And then my third theme was a specialized care desert, which basically talks about how there's a lack of specialized care. And I also found this theme across both sickle cell disease and cystic fibrosis, where patients had a lack of specialized care like pulmonologists or a hematologist in their area, or if so, it was like extremely far distance away, like 6-hour drive.
I've never heard that term before, but that's totally, so like a food desert.
Yeah, exactly like that, but
okay.
for specialized care,
Right.
Which is why like so many people turn to like the emergency room as their first line of defense, like specifically like just the physical barriers of trying to get there. It's like 6 hours away. And then my fourth one was psychosocial and behavioral consequences, which basically they're talking about how it leads to like anxiety and depression and just a lower mental health and quality of life.
Okay.
Yeah.
So the mental toll of not just having the disease itself, but all of the ramifications that come with it, probably because of the things you're talking about. Like, I can't get to someone who's a specialist for the disease that I have.
Yeah, exactly.
Yeah, that's a very good summation of how you approach this. Were there key differences that you noticed between sickle cell and cystic fibrosis with these different codes that you were applying?
Yeah, so that is actually like my fifth inductive theme. It was basically talking about how these codes like compared between the two. So it was called institutional gaslighting versus logistical friction, and it was basically talking about for the negatively coded post in sickle cell disease, it was more so active identity-based like friction based on manipulation or lies or basically disbelief of the patient, it's herself or not herself, themselves, But compared to logistical friction in the more cystic fibrosis post where it was talking about wait times or lack of access to a provider or the physical barriers to accessing care. So it was more of an issue within the system itself versus with sickle cell disease, it was more of an identity-based, like with their disease itself. Yeah,
that's an interesting conclusion. So let me repeat this back. You're saying with the cystic fibrosis, it's more of the critiques that were being proposed were about like healthcare, just the process of how healthcare works in this country.
Yeah.
And then with the sickle cell, it wasn't really about the healthcare. Well, I mean, it's ultimately all about healthcare, but it was more pointed. It was more personal in that way. Mm-hmm. Based on what you read and the patterns that you saw, like what were the conclusions that you drew when you saw that in your data?
Yeah, I mean, it sort of made sense because with all like the sources that I've seen, like there are many papers out there that I saw like when I was starting my work that actually did compare like sickle cell and cystic fibrosis. So it was interesting to see like how my findings were like in cooperation with that. And specifically, it also makes sense because in terms of like funding and things like that, a lot of my sources like Farouk et al. 2020, they talked about how there was 971 times more private funding for cystic fibrosis than sickle cell disease. And my findings basically saw that how that translated into like direct patient care with a lack of care access for those patients specifically.
And just by the numbers, do you know this offhand? How many cystic fibrosis sufferers do we have in the U.S. compared to sickle cell sufferers?
Yeah, so we have around 100,000 Americans with sickle cell disease versus 30,000 with cystic fibrosis.
So triple the amount.
Yeah, in the United States at least.
And yet the funding disparity exists.
Exactly. specifically for private funding, yeah.
No.
But also for federal funding, it's like 3.4 times more for cystic fibrosis, something like that.
In talking to you, it's evident that you have, I mean, you used like minimal notes while we were having this conversation. You needed to pull it up at that one point for the inductive process. But in just the description of your process and me just kind of looking over your shoulder over the course of the year, you definitely got way more organized with the way that you were coding. And it seemed to just, there was a point where I felt like you got into like this flow where it was like, okay, this is clicking now. Like maybe it was harder to figure out how you were going to approach it, but then you had this framework of here's my spreadsheet, this is how it's going to work. Had you ever had to deal with that level of organization in your schooling prior? And if so, like, did that help in this context?
Honestly, no. Like for AP research specifically, like I have to make like a whole Google Drive folder organized by like month just to keep all my documents in one place. Like I've never for another course had to like create something to be like so organized or else I'll be like lost because I just had so much stuff that I had to keep track of in AP research. And yeah, no, I don't think I've ever had that like level of need for organization and like deep work.
So how did you adapt? Like what was it? Like what resources did you use to adapt, I guess is the question. Because sometimes I see students in those situations who just, I mean, I even have students now who argue with me, like, why do I need to keep anything in a folder? And I in a weird sense, I do understand where they're coming from. I was just having a conversation with a friend where he was like, look, if your naming conventions are good, you don't need folders in Google Drive. He's like, you just search. You just like, you basically almost use Google Drive like a search engine. That doesn't fly with me because I feel like if I have folders, at least you can do what you kind of mentioned. Like you can almost stumble upon things sometimes when they're in a folder. You're like, oh my gosh, I would have never even thought to look for that because I totally forgot about it. You know what I mean? So yeah, how did you go about making that adjustment and that evolution?
Well, like the first month, it was kind of hard to get used to, like in September, or I think we started making the Google Drive in like October.
Yeah, October.
Yeah,
about right.
But I put like all my annotated bibs in there, and I organized like my initial findings in like Google Docs and stuff. And then when I look back on it, I noticed like, oh yeah, this is a lot easier. So like I was like, okay, let me just make this easier for myself. So I just kept like organizing it into like different folders. And then in terms of like actually using like Google Sheets and Google Docs, I actually had like some friends help me, and I also asked some questions like about how to use Google Sheets because admittedly like I had never really used Google Sheets prior to like making my master like data set. And I didn't even know how to like do like a fold over into like how you like fold over a text into like one single cell instead of letting it run on.
Text wrapping.
Yeah, text wrapping. That's what
I feel like that was the thing I helped most students with.
Yeah,
they're
it's
like,
like
how
the
do
small
I get
things.
it to just do that? And I was like,
oh my god, I have to like scroll like on like one line. Yeah, but then I think just time also helped, just getting used to the process.
Yeah, well, it's learning a new skill, and you know, now that you mention it, I feel like there's just such a prevailing idea in education. It's like, oh, they're digital natives, they'll figure it out. These kids have always had a screen since they were born. It's just like, I even looking at my own children, I'm like, you do not know how to use this thing. It's like I'm not trying to be like an old curmudgeon here. The youth of today definitely know how to use devices, but in a very particular way of usually accessing information. But then once they get that information, not necessarily knowing best practices of how to organize that information, or like you were saying before, like even having the foresight to take a note and be like, this may be nothing, but maybe one day it's gonna pay off. I don't know. I don't know if you agree with that.
Yeah, I see that.
Like when you were in third grade, did anyone teach you how to organize a Google Drive?
I actually think so. We had like technology class.
Okay, so that was happening. So it did occur. There was something in there.
Yeah, but I don't think I like remembered it. But yeah.
Well, you don't remember it until you use it, and really, what's the complexity of your third grade organization need to be at that point?
Yeah, no.
But when you're managing a year-long project, you can only do what your level of organization allows you to do.
Yeah.
So if your work's a hot mess,
it's a hot mess.
It's a hot mess. It's going to be really hard to draw as articulate of conclusions as you were drawing earlier. It's just going to be so hard to do that. Were there any other adjustments that you noticed in yourself as a student over the course of the year where you were like, because this is a tough. If I was 16 years old, I would not have taken this class. I don't even. Are you 16?
Yeah, I'm 16.
Yeah, okay. If I was 16 years old in high school, if any of my teachers were ever to listen to this podcast, they'd be like, that is the last person I probably would imagine to be teaching an AP research class. So is there anything else you noticed in your habits where you're like, you know what, this is a good skill? Like, I mean, organization is a highly transferable skill, but anything else you picked up on?
I think just agility in Google Sheets and Google Docs, those really helped me because I didn't really have to use them to the degree that I like use them in my project. Like having different tabs in Google Sheets, I'd never done that. Or like, and also how to like format papers, for example, and how to make it like visually appealing. Like my friend helped me create like graphs or tables in Google Docs, and I never realized like you can like highlight the text and make the text, highlight the box and make the text white, and it'll help it stand out more. Like
like those kind of things.
Just like the small habits. Design choices and just agility using them. I think that really helped me just throughout, because I feel like if I didn't know how to use like Google Sheets or shortcuts with Google Docs, it definitely would have taken a lot longer.
With your topic of your level of interest in this intersection of social science and biological sciences, is this something you see yourself looking into in the future? Like, is this something you want to pursue at a undergrad or graduate level, or was it something that you were just curious about now and you wanted to bring that TikTok post to an end?
I mean, yeah, I can definitely see myself like exploring this issue more. I do want to go into like medical science, like in college. So I guess I can see how that could overlap. And yeah, I would love to have like an opportunity to do like actual like research on that maybe. Or like maybe like the biological part of it too. That like really interests me in terms of like the gene mutations. I would love to learn more.
Well, if you were ever treating patients, you would know to listen and not stigmatize their pain.
Exactly.
Or to classify them as having drug-seeking behaviors if they were in pain.
Never do that.
It gives you a certain level of empathy. I know you're very busy today. You've got jazz. You got jazz band to play. What do you play?
Flute.
You play the flute?
Yeah, I play the flute.
The jazz flute?
I don't even know. I just play whatever he gives me.
Okay, all right. I don't know if there was a difference between a jazz flute and a regular flute. Does anyone know? Anyone in the audience know? Is there a difference between a jazz flute and a regular flute?
Like in terms of the actual instrument?
Yeah.
No, it's like the same instrument.
It's the same instrument?
Yeah.
You're
but
just
it's
playing
like,
a jazzier way?
Yeah. I don't know.
I don't know either.
Yeah.
Do you have any words of advice you'd like to give up-and-coming seminar or research students, or anyone out there who's interested in original high school research?
I would say don't be scared to do something that you're actually interested in. Because I feel like for me, I was pretty interested in this topic, and I was scared that, maybe it wouldn't align with like a strict, because everybody around me, like I saw people who were doing like really quantitative like research, like doing strict tests, like t-tests, chi-square tests. Yeah. But I didn't do any of that because it didn't really align with what I wanted to do in terms of like my topic. So
that totally makes sense. All right. Well, thank you, Chloe.
Thank you.
All right. Go jazz it up.
Yay.
All right.